Anorexia nervosa is a disorder more common in girls than boys, but it can be found in boys as well. Usually starts off in childhood, usually around the time of adolescence, and it involves a fear of becoming fat. So it's a fear of fatness that is unrealistic and that involves restricting the caloric intake that the anorexic takes in. So they will become, they will develop to their disorder will develop to the point that they begin restricting what they eat. So at the beginning, they may restrict eating fatty foods. And then they may be to the point where they restrict eating sugary foods or carbohydrates. And it may result in the fact that they have such a fear of getting fat that they will then begin to avoid all foods except for vegetables or salads or the like, so that they may restrict their diet to the point that they begin to lose so much weight that it becomes unhealthy. But another part of anorexia is a distorted body image. So the anorexic girl who may weigh way below her normal acceptable body weight may look at herself in the mirror. Other people see her as skin and bones, and she looks in the mirror and sees that she's fat. And you say, "Where are you fat?" And they say, "Well, on my cheek or on my rear end or something." But they will find that fatness and they fear being fat, so they will continue their restriction to the point that tragically, sometimes they develop medical complications and even die from their eating disorder, all the while believing, even though they look like skeletons clad in skin, that they are fat. And most of the experts believe that in anorexia, it is the control of what the girl or the patient puts in their body that is the issue. This is the one thing that they can control totally. They may not be able to control other things in their lives, either family issues or friend issues or grades or the like, but they can control what they put into their bodies. In anorexia, it becomes obsessive and unrealistic, so that you try to talk quote-unquote sense to the anorexic and she just can't hear you. Or if she hears you, she doesn't take it inside and often will not change their behavior. Even when their physician says, "Look it, you continue doing this, you're going to die." They will continue it because the urge, the fear of fat, the urge to control what they take into their bodies in terms of food is so overwhelming that they feel helpless to control it.